Hello, how are you? A lot of people say that cholesterol medications can cause diabetes, harm the liver, and cause muscle pain. Today I'm going to tell you what's actually true about this, what science really says, and the importance of these medications in your routine. You're going to love this video, so stay until the end, you won't want to miss it. Before we start, I want to ask you, do you have high cholesterol? What was your last cholesterol level on your most recent blood test? And how long ago did you take that test? That's important too. Do you take any medication to help control your cholesterol? Or do you try to manage it only through lifestyle, with diet and physical exercise? Write to me in the comments, I'd love to see your response. And if you can, please also give the video a like. That's super important to me. It also shows YouTube that you support the channel and trust my content. Before we begin, we need to mention that cholesterol itself isn't necessarily a villain, right? We know that cholesterol is essential for our cell membranes. All the cells in our body contain cholesterol. It's also essential for the production of various hormones, even vitamin D, which is super important for our body. The problem isn't cholesterol itself, but rather the excess cholesterol circulating in our blood, especially LDL, which is the bad cholesterol. It can build up in our arteries and cause inflammation. We know that oxidized cholesterol is even worse for our cardiovascular system, and this cholesterol can form plaques. That is where the danger lies, because over time, these plaques increase the risk of heart attack and stroke. That's where statins come in. These are the cholesterol-lowering medications, right? Like rosuvastatin, atorvastatin, and simvastatin. They work by blocking an enzyme that the liver uses to produce more cholesterol. As a result, they reduce LDL, commonly called the bad cholesterol, slightly increase HDL, the good cholesterol, and also help decrease inflammation within the arteries. Because of these combined effects, their benefits go well beyond simply lowering cholesterol numbers. They act on the difference on this issue of the different types of cholesterol and inflammation of the arteries. So they end up having a very comprehensive effect for your body. But there are a lot of people who think, well, do I really need this medication? Because I already eat well, can I try just with my diet? You can always try with your diet, but there are some people who have a harder time controlling cholesterol with diet alone because their own liver already produces excess cholesterol due to genetic factors, family factors. That's what we call familial hypercholesterolemia. You probably know someone who has this. Because even with diet, exercise, and a healthy lifestyle, this production remains high and that person's cardiovascular risk stays elevated. So, lifestyle changes reduce a person's cholesterol by an average of 15% to 20%, while statins, which are these medications, can achieve reductions of over 50%. In other words, diet and exercise are still fundamental for your health, but in some cases, they might not be enough for you to achieve the control you need. So maybe, in some cases, medication is indeed necessary. Let's talk then about the side effects that statins cause for many people. I think the first one that a lot of people report is muscle pain. Have you ever experienced any muscle pain after you started taking statins? They affect between 1% and 10% of people. Usually they are mild and disappear when the doctor adjusts the dose or changes the type of statin. So, if you have been suffering from this pain, it's worth talking to your doctor because they might be able to change the type of statin you're taking, and usually that can help improve things for you. Physiologically, this happens because statins also reduce the production of coenzyme Q10, which is essential for the energy of the muscle cells in our body. That's why some doctors recommend that you supplement with coenzyme Q10 between 100 and 200 milligrams per day. This is especially recommended when you start feeling very tired or have muscle pain after you begin taking statins. So, you can talk to your cardiologist and check in your case if you have already been experiencing a lot of muscle pain, whether it is worth supplementing with coenzyme Q10 or not. Another myth is that statins can cause memory problems, issues with your brain. There's a myth that they even increase your risk of Alzheimer's. I'll tell you right now that this is a myth because recent studies actually show the opposite. There was a meta-analysis by the European Society of Cardiology and a study published in The Lancet, which is a highly respected scientific journal, that proved that people who use statins have up to a 20% lower risk of developing dementia, a 28% lower risk of Alzheimer's, and an 18% lower risk of vascular dementia. In other words, it actually helps control cholesterol, right? And as a bonus, it protects your brain, preventing those microlesions that can lead to memory loss. So, if you're worried about taking statins because you think they might harm your brain health, or your memory, on the contrary, they can actually have a protective effect for you. There's also another controversial topic. There are people saying that statins can increase the risk of diabetes. And yes, it can slightly raise blood sugar levels in some people, especially those who are already prone to diabetes, like people who are overweight, very sedentary, or already had insulin resistance. We know that often all of these things tend to go hand in hand, right? A sedentary lifestyle already makes a person have high cholesterol. So basically, they already had this combination together. But it's important to put things into perspective, right? Because the risk of diabetes can increase when you take statins. According to scientific studies, it's about 9% to 12%, but the risk of stroke or heart attack can drop by up to 200%, so your doctor will weigh these factors. And also, rosuvastatin and atorvastatin can slightly increase blood glucose, but this effect is reversible. As I mentioned, it's very minor, and it usually improves a lot when you manage to lose weight, exercise, and improve your diet. So, when you improve your lifestyle, keep taking your medication, and eat better, usually this insulin resistance will improve, and your blood glucose levels will become more stable. So lifestyle really ends up being the most important factor, okay? I have a playlist here with lots of tips to help you control your blood sugar. I'll leave it down below in the description for you as well. Another question is whether rosuvastatin or statins in general are harmful to the liver. Because some people have a slight increase in liver enzymes, AST and ALT, which indicates that the liver may be adapting to the medication. This happens in very few people, about 1% to 3% of cases. And in many cases, this effect ends up being temporary and doesn't actually cause liver damage. So, the guidelines from the American Heart Association are very clear. You should only stop the medication if the enzymes rise to 3 times above the normal value, and if there are associated symptoms. In most cases, the treatment will continue without any problems. And furthermore, in people with fatty liver who already have hepatic steatosis, the use of statins can even help reduce inflammation and improve liver health. So, if you have any questions, it's worth consulting your cardiologist or your hepatologist to confirm this information, specifically for your case. Remember that this video is for informational purposes only, so it's always worth reminding ourselves that any medication you take must be recommended and prescribed by the doctor who is personally following your case, right? And that many times these medications are truly indicated for you because the risks are very small compared to the benefits, right? The benefits far outweigh these small risks. Because when you look at 1,000 patients who took this statin, fewer than 1 will have a serious side effect and more than 30 or 40 heart attacks and strokes will be prevented. So, sometimes it's worth it for you to use the medication. Of course, the medication is not a free pass for you to live an unbalanced life. I'm taking cholesterol medication, so now I'm going to stuff myself with fried snacks, drink a lot of alcohol, and start smoking again. That's not how it works. So ideally, you should always, according to your doctor's recommendation, take the lowest effective dose of any medication so that it achieves the intended medicinal effect. Get regular tests for liver function, kidney function, and even heart function. Maintain a healthy weight and eat well. Have a diet rich in low glycemic index carbohydrates, healthy fats, high biological value proteins with as few processed foods as possible, always prioritizing natural foods. Avoid alcoholic beverages, avoid smoking, get good sleep, and lead a less stressful life. All of this will help your heart in a complementary way. There's no point in thinking, I'm taking statins, so can I eat whatever I want? Can I skip exercising? Can I drink every day? That's not how it works, okay? Statins aren't going to work miracles. You have to help the statin help you. Tell me which statin have you taken if you have. If you took it, were you able to improve your levels and your doctor took you off it? Were you able to maintain good cholesterol levels? Are you still in this process? I want to know. Write to me in the comments. I would love to see your comment. Remember to like the video, that will help me a lot. And share this video with anyone who needs this information, with anyone you think will be interested. Let's do this together and spread the good. That's exactly what I want for this channel. See you next time. Bye.